Namaste and good afternoon. Greetings from all of us at Apollo Hospitals. This is Dr. Sreenidhi Chidambaram, and I'm very happy to see all of you again. Welcome to today's Facebook Live session. At Apollo Hospitals, with our motto of touching lives, we place great importance on creating health awareness among people, as we know that early detection of disease is crucial to better outcomes. We also believe in bringing you information of topical relevance and importance so that you will have the facts at your fingertips and are able to take all steps to keep yourself in perfect health at all times. As the temperature dips in many parts of our country, we must know that the cold weather does not affect only the skin, but also affects vital organs such as the heart and the lungs. It's really all about how the body reacts to the cold. The body's first reaction is to keep warm. So blood vessels constrict to keep in the heat. The heart also beats faster. The blood pressure may go up. So for people with underlying heart disease, it's very important to know what to do during the cold season. It's important to discuss this topic of how the winter affects the heart. To discuss this, I am delighted to welcome Dr. A. Sreenivas Kumar, who is Senior Consultant Cardiologist, Director Cardiology and Clinical Research at Apollo Hospitals, Jubilee Hills, Hyderabad. Dr. Sreenivas Kumar is Professor of Medicine too at the Apollo Institute of Medical Sciences. He is Chairman, FACTS Professional Services, Founder, Director, and CEO, FACTS, which is the Fraternity of Advanced Cardiovascular Techniques and Solutions. He was the CSI NIC Chairman in 2018-19 and past President of the APCSI. Welcome, Dr. Sreenivas Kumar, to our session today. I'm so happy that you could find time to join us. So let's begin by asking you, what happens to the heart during winter? How does cold weather affect the heart?
Yeah, welcome all the viewers of Facebook Live for Apollo. Thank you, madam, for making me join this program and interact with all of you. Thanks for your kind words of introduction. As you already told in the introduction, any extremes of temperature, body takes time to adjust itself, and extremes of the temperature in the mean, cold, if any temperatures go down below 20, and it's going down further less, then probably we need to be a little careful. So anywhere in between 20 and 37, still it is okay, but if it goes down further less, like in north some areas and sometimes very rarely in Hyderabad, you need to be a little more careful. So if you see what happens when the temperatures go down slowly, when you normally your skin perceives it as a little colder temperature and you get shiverings, similar things would happen within the vascular system of the blood, heart. So the blood vessels tend to get constricted, they go into spasm, and then the pressures in the blood could increase. So the blood pressure increases, and then heart also could beat faster. And then anybody who has a smaller plaques inside the blood vessels of the heart could develop also small plaque ruptures. And that's how there could be slightly more incidence of acute coronary syndromes and heart attacks during these winters. Other important mechanism by which heart diseases could increase in these cold seasons is people tend to get recurrent respiratory tract infections and then cough, cold like thing, which could be actually also triggering. There is a theory called plaques getting unstable, and there's infection theory for plaque ruptures, which leads to acute coronary syndromes and heart attacks. So that could be another mechanism by which intercurrent infections could also precipitate plaque ruptures and lead to acute coronary syndrome events. Apart from this, we already had experienced the pandemic. Luckily, it's all settling now. Such sort of, if not COVID, any other viral infections could also precipitate some of these problems happening. So these are some of the fewer mechanisms by which you need to be careful in the cold season not to get into heart troubles.
So what are the common conditions, the heart conditions that can affect the heart during winter? You were mentioning about the increased risk for heart attacks. So what are the various other complications that can happen?
Yeah, either heart attack or we call acute coronary syndromes. It could be like minor heart attack like thing. what we call as unstable angina or NSTEMIS also could happen. So that is one major important thing. The other thing is patients who already have LV dysfunction or heart failure, then probably that could get precipitated in the sense that if you see pumping function being less, people tend to develop swelling in the body, which we call it as edema. And that sort of things also could get precipitated. So most important thing, what we need to take care is you need to be taking your medicines regularly, not to miss out any medicines, and not to get exposed to too much of extremes of temperature. So one thing what we mentioned is acute coronary syndromes, heart attacks. Other thing what I've said is heart failure syndrome. Heart failure is again a complex syndrome where each of the heart problems could end with heart failure, like heart attacks could go into heart failure, heart valves being problematic, either leaking or stenotic could go into heart failure. And sometimes infections of the heart muscle called myocarditis could also go into heart failure. So it's basically a syndrome. All that problems could also get precipitated during winters.
So let's talk a little more about heart attacks in general. So that is one of the main risks that can happen during the winter. But even in general, what are the warning signs of a heart attack?
In general, it's a very important question for everybody to understand and know about it. Obviously, there could be some sort of variations happening. You need to spend 2 decades to know what is how to diagnose heart disease properly. But for just the sake of idea for the viewers, any discomfort which happens from the lower jaw to the umbilicus in between both arms and which increases with exertion, climbing upstairs, things like that, decreases by taking rest. So this is generally typical of heart pain. Like if on the other hand, somebody gets continuous localized pricking pain persisting throughout, no change with exertion. So that is less likely to be heart pain. But any sort of discomfort, especially you're not able to vocalize, the person will not be able to localize at one particular point. He'll point with a full chest, fist like in the chest, retrosternal discomfort, relating to jaw or both arms, increasing with exertion and decreasing with rest, is generally considered to be a heart pain. We call it as angina. But when the same pain starts appearing even at rest without much of exertion itself, that we go into stage of unstable angina. And if it's not taken care, then continuous persisting rest pain of more than 30 minutes, that's what we call in medical terminology myocardial infarction or heart attack. So this is the typical characteristic of pain. So which is whenever anything happening in exertion, be careful and go to the nearest doctor and get yourself evaluated.
So what would be, so could we talk about that in a little more detail? If somebody has these symptoms, what are the emergency measures that are usually undertaken?
The most important is first, don't neglect. Try to go to the nearby place and seek medical attention, where the doctor takes ECG and then diagnoses what is a heart attack. But before that, as a first aid, if you have a tablet of aspirin, or sometimes if you have more advanced antiplatelet drugs like clopidogrel or statin, which is cholesterol lowering medicines, if you have it, you can take it. Sublingual nitrate is another tablet where which actually kept on the tongue. It dilates the vessels and prevents from getting totally occluded. So these are some of the first aid measures, but only precaution in taking sublingual sorbitrate is your blood pressures need to be normal to have it. Sometimes your blood pressure is already low. If you take sorbitrate, then probably pressures could fall further and the patients could get syncope and fall down. This is only precaution, but otherwise, if you can get up and sit, also gives some rest. But in that process, people tend to walk around a lot. Then that also stresses the heart. So sit at one place, get up and sit comfortably. And then if tablets arbitrate and aspirin, clopidogrel, statin is available, you can take it. But the most important is without wasting much time. If you can go within first 1 hour to places like Apollo, where the patients are directly read in from emergency to cath lab, that is what is called the golden hour. Even if you suffer heart attack, you can still maintain your heart normally once the blood vessel is open. So damage to heart can be prevented. So this is the concept of golden hour for the heart attack patients. So if any discomfort and if severe enough, again, associated with sweating and the typical characteristics, so immediately don't neglect and go to the hospital, take an ECG and get further evaluation.
So coming back to winter, so we already spoke about how people are at risk for angina or heart attacks during the cold weather. So are there any particular categories of people who are at more at risk for these things? Like supposing somebody already has a heart disease, or who are the people who are more susceptible to heart issues during the winter?
So high risk people, you're saying. So
Yes.
basically, elderly population who is at 70 years plus are not very active, fragile people, what we call frail personalities, and people who already have pre-existing lung problem, like what we call as asthma or COPD, or people who already suffered heart attack where pumping is less. There's heart failure type of patients, and then patients who already suffered one or two events like heart attacks or acute coronary syndromes before. So these are some of the side patients who have diabetes and the patients who have chronic kidney disease. These are some of the people who will be more prone for the precipitation of the problems during winters. So for this sort of all these people, the precautions are don't get yourself exposed. And even if you by chance you have to go, then probably cover yourself well and wear warm clothes. And again, be comfortable and don't try to avoid direct inhalation of very cold air, and then try to protect yourself. And never ever miss the tablets which you're taking before. Like some of you, some of the patients will be taking aspirin and cholesterol lowering medicines and clopidogrel other medicines. Please don't miss out these tablets because it's very important not to miss out the tablets during this season. So as to avoid precipitation of problems.
Another question that arises is exercising in winter. So one always tells that you go for your morning walk and things like that. But then, what are the restrictions in this case in winter? What are your tips for advice, or what is your advice for exercise during winter?
Exercise, I want to stress that anything a person can do comfortably is also comfortable for heart. If you are not feeling well, then if you feel too cold, obviously don't do it. Suppose if you are comfortable, you are enjoying that type of walking, that little cold weather, it is okay. But if it's too cold, up to 10, less than 15 degrees centigrade, then you may not do that thing. On the other hand, if you have facilities to walk around in your own place or do a low speed treadmill or cycling or little of that sort, or if you can't do anything, at least sitting ideally and doing some sort of yoga, meditation, all those are helpful. Many people have the habits of doing weightlifting and severe going to gyms and doing severe exertions. Those things are not to be done, especially the fast thing, like you want to finish exercise within half an hour and then you, without warming up and without cooling up the body, you do everything at a very fast pace. That's where you land in trouble. That's where you hear stories that plaques rupture and people have died suddenly during gyms and exercises. So anything undue exertion is not good. If you're able to comfortably do it, and please do it. But the precaution is gradually warm up, and then actually once you do some exercise again, gradually do cooling up. If your body is liking it, generally it is good, but don't force yourself too much. So as the saying in Sanskrit goes, "Ati sarvatra varjet." Anything which is extremes, anything you can't handle it, could become harmful. So if you have to generally know, walking is a brisk walking is a good sort of exercise. But if you feel too chilly and cold, then you can do some within the in-house. People have described figure of eight walking, various types of little activities, and yoga, meditation. Again, yoga is very good for prevention of heart troubles. This is India's gift to the world. And whatever types of, again, in yoga also, you need not do reverse postures and all that, which is very difficult. So at least breathing exercises and then probably concentration and meditation, a little sort of stretching exercises, which are good and which you can do comfortably, are good for the patients.
Let's talk a little bit about lung conditions. You were mentioning that, in winter, people are also prone to respiratory infections. So what is the link between that and heart disease?
Actually, the concept and the theory in heart disease precipitation, which we call as acute coronary syndromes, the small plaques, the cholesterol deposits within the blood vessels due to the cold weather or because of extremes of exertion or because of intercurrent infections. There is what is called an inflammation within the plaques. And then when the plaques get inflamed, there could be small ruptures, plaque ruptures, what we call. Once a rupture of the plaque happens, all the blood vessels, blood cells inside, like platelets and RBC and fibrinogen, all that material gets deposited there and the clots form. When the clot increases further, when the entire artery gets obstructed, that's where thrombus forms. And if artery gets totally occluded, then heart attacks happen. So inflammation, infection, some sort of viral infections or chlamydial infections or what are described could be precipitating the plaques and ruptures leading to heart. Per se, they may not directly be able to cause heart attack, but people who already have a plaque small inside are prone to ruptures and develop into heart problems. Other thing, what happens with infections is patients who have borderline pumping function, heart pumping, because of some reason, either cardiomyopathy or heart attack, if heart pumping is less, then this sort of infections, the bronchospasm of the lung pressure, the pulmonary artery pressures increase, and the heart tend to worsen. With this pre-existing normal heart could be able to sustain even this infection, but this sort of the patients who already have a compromised heart, they go into more of severe heart breathlessness called left ventricular failure, and that's how they land up in hospitals. So these are some of the ways by which lung conditions can lead to heart problems. The chronic lung conditions called COPD or chronic obstructive pulmonary disease or asthma type of problems. When they're chronically present, the right side of the heart gets affected, and the right side chambers of the heart called the right atrium, right ventricle, and the pulmonary artery, they all get dilated, and the pressures on the right side also increase, and patients tend to get swellings in their legs. This is what is called as car pulmonale, where primarily because of lung problem, the hearts get affected, and the patient goes into swelling of feet and things like that. So these are some of the forms by which lung condition can lead to heart.
Are there any dietary tips during winter? Because this is a season where generally one tends to feel more hungry, and people with heart disease, what kind of special precautions should they follow when it comes to nutrition?
So basically, anything excess is again not good, and taking too much of salt or spicy foods again is not good, even in these things. And whatever forms of the entire in general, also vegetarian foods are supposed to be good. Somebody is taking non-vegetarian, probably fish is okay, and then probably some eggs, white things like that, protein food is okay. Avoid taking too much spicy foods. Avoid taking too much of sweets and sugars. In general, those are precautions. The vegetarian diet is supposed to be good. Suppose somebody has some allergy, some type of asthma, by which some foods precipitate those problems, we should try to avoid them. But by and large, eat small quantities more frequently. That's what is better. And then any form of things which you're fond of, taking too much is not good. Suppose you think eating almonds or badams or walnuts are good, chocolate sometimes. If you eat tons of them, again, they will be bad. Similarly, fruits are supposed to be good. And whatever you eat, again, if you avoid diabetes, you should avoid fruits which contain high sugars like banana and mangoes, but papaya, then probably guava, things like that are okay. Generally, fruits and vegetables are good, and our sweets and high fatty foods are to be avoided.
What is also your advice regarding smoking and alcohol consumption during the winter months, and how does it affect the heart?
Bad is bad anytime, so it becomes more bad in winters maybe, because heart, you have described alcohol might tend to get into heart troubles more, especially when the heart pumping is weak. So that's why people who already have pre-existing pumping function disorders is a big no to heart alcohol. And then people who tend to get beating abnormalities of the heart called arrhythmias, atrial fibrillation. Again, it is a big no for alcohol because that might get precipitated. There's a syndrome called holiday heart syndrome, where people tend to take a little more alcohol and then they beat faster. And when the heart beats faster with atrial fibrillation, small clots could go into brain, and then paralysis also could happen. So these are the things which you should try to avoid. So smoking and alcohol, anyway, not good. People think that alcohol gives some warmth and it's all good for
Yeah,
the
that is
heart
my
and all
health.
that. That's not right. Large study which is done in a lot of countries with long-term outcomes, and people for all age groups, all types of alcohols are studied. In that, it's shown that alcohol in any form does no good to heart patients, especially don't if the pumping function is less, it's a big no. Many people think that HDL cholesterol, which is a good type of cholesterol, could increase with alcohol intake, but that's also very minimal. On the other hand, if you take alcohol today and check your triglycerides tomorrow, it may go up to 300 to 500, which is immediately damaging to heart. So smoking again in any form is again very bad. Wherever there's a blood supply, all the organs could get affected by smoking. Not only the blood supply is decreased, but also, as we know, smoking can also increase cancer incidence. So smoking and alcohol is a big no anytime, and more so even in winters.
As you said, doctor, the caring for one's heart doesn't really know any seasons. It has to be done throughout the year. So, could we conclude this session with some general observations about how people should take care of their heart? What kind of preventive checks should they undergo? Some general advice on heart health.
Any program I do, I keep telling about. We heard in after independence, Panchavarsha Pranalika, the 5-year plans were there. So similarly, I designed something called Panchasutra for prevention for heart disease. So all these Panchasutra is not my own. It is basically studied, tested in long term, and proven that if somebody can follow this Panchasutra, the 5 principles which I'm going to tell, you can decrease your heart attack and paralysis incidents, but not by 10, 20, 30, but by 81%. So people have studied people who followed these 5 principles versus those who were careless. The incidence of heart attacks, paralysis significantly decreased by 81%. So if you have to see what are they are very simple. All of us could do it, but many of us unfortunately don't do that. Number one, you should sleep well adequately for 5 to 7 hours a day. When you're during a sleep, your entire cells, the stress and strain which your body gets, all gets into reparative process and you recover. All of you might have experienced if you don't sleep, then you get into a lot of fatigue and a lot of troubles. So sleep, adequate amount of sleep a day is important. Number two, whenever you're active again, little sort of exercise, what we have discussed, is important. Life is equivalent to motion and activity. Any sort of activity, either 30 minutes a day, 5 days in a week is what is recommended. 2 days, God is kind enough to give you holidays. So at least, but if you do for 5 minutes and be happy that you're doing a lot of exercise, that's not good. So brisk walking or some sort of moderate intensity exercise for 30 minutes a day, 5 days in a week, again will prevent a lot of heart problems. So if you can't do walking, jogging, at least you yoga, meditation, and for 5 days in a week is good. That is second is activity or exercise. Third is food intake is important. I'm not telling you to do fasting or don't eat that this. Anything you want to eat, you eat in moderation. So if in general also vegetarian diet is good. Don't take too much of non-vegetarian stuff. So anything you eat in little quantities is okay. And many people tend to ask about questions of oils and all that. People say it is almond oil, olive oil is all good, but anything in moderation is fine. Rotation of oils is supposed to be beneficial. Then fourth important thing I would say, I would not say it as a negative connotation, avoid stress, but in general, be happy. Being happy, again, not causing trouble to others. Don't cause inconvenience to others, but if you can help others and be happy for yourself, avoid stress. That is again very important, easy to say, but difficult to do. Yoga meditation also could help in this. And lastly, fifth, if you have any sort of risk factors, unfortunately, diabetes, blood pressure, high cholesterol, we should take treatment immediately. And if you follow all these 5 principles, like sleep well, eat healthy, do exercise, and be happy. And if you have risk factors, then control them. You could prevent your heart attacks by 81%. So as to encourage people to follow this, Apollo, we started like Apollo Healthy Heart Checks, and where everything is done at a much subsidized price. And then if some risk factors are detected, like blood pressure, diabetes, cholesterol, the doctors see and they give you treatment. And this program was another specialty of this program is once you get registered with this, it will follow for 3 years. and the health workers, the doctors will call that patient back and see that at least you get into good habit of health for 3 years so that you can maintain your healthy lifestyle. So health should be seen positively. Don't come to hospitals only when you become sick, but also to promote a positive health is a concept with this heart health check is encouraged in Apollo. And we're happy that lakhs and lakhs of patients at Apollos across the country are getting benefited. But many of them still feel that these are done for, if suppose you get detected with some problem, how it is, but it is in fact good because before it strikes you hard, if you can have detection of it, then you can take treatment and prevent in landing in emergencies. So this is very important concept with the chairman and all others are promoting. I request all of you to get yourself checked up, especially when you have a positive family history, somebody in your family suffered heart attacks, then that is where you need to be a little more careful and evaluate yourself. And if you follow the 5 principles, what I mentioned, you can maintain your health again and be happy and healthy. Thank you.
Thank you so much, Doctor. So thank you, Dr. Sreenivas Kumar, for this wonderful discussion. And viewers, please take care. Do not ignore warning symptoms and stay well during the winter months, keeping your heart healthy. Do whatever you can to stay in the best possible shape when winter rolls around. And please remember that the 5 tips that the doctor said, the 5 cardinal rules of heart health are always in season. So you don't need to wait for any season of the year, but maintain it throughout the year, which means stick to a heart healthy diet, be sure to exercise regularly. And it's also important to know your numbers, to know your blood pressure, your cholesterol, your blood sugar numbers. So do take the screening program and manage your stress, sleep well, but above all, listen to your body. And if you feel any different, please seek medical help immediately. You can always contact us on any of our digital channels. We're always there to help you, support you. You can contact us for any assistance. And of course, our hospitals and clinics are available throughout the country to provide you any help and assistance that you need. If you have any more queries, do reach out to us on our social media channels. Please subscribe to our YouTube channel as well to catch the latest on health information and trending topics. So till we see you the next time, thank you. Stay safe. Namaste.